class. First, we're going to start off with our model here, which I'm using a blow-up doll instead of a real live person so that we don't embarrass anybody when we do the butt lift portion. And this one is kind of invasive as well, so we just wanted to use a blow-up model. You see, this is how you would have them draped. You can use whatever type of draping you use. If you use disposable underwear, that's fine. Me, because I'm coming from a massage background, I still use sheets. So cover this, expose the abdomen for what I call the 360 snatch. So first, you're using arnica oil, which if anybody is post-surgery, they're already hip to the arnica oil. I still use it with this just because it just has so many benefits: plumping up the skin, increasing circulation, anti-inflammatory as well. So I'm still using arnica oil. Also, you want to keep in mind that if you are doing someone who has had cosmetic surgery, you want to make sure they're 6 to 8 weeks out, because if they still have fluid, this is going to be pretty painful. The good thing about wood therapy is that it does still drain the lymphatic system and stimulates the lymphatic system. But like I said, 2 to 3 weeks too soon, 6 to 8 weeks right in your sweet spot, and anywhere after that. Also, wood therapy works on anyone who has not had surgery at all. So the first tool that I use with my 360 snatch is the engraved massage roller. Here you want to go in and you're going in this motion and you're going up and down. And the fact that I can use this on a blow-up doll is showing you how superficial you're going. You're not hurting this person. You're not going so deep that they're turning red, which will happen with some people. But you're just going superficial over the skin, stimulating that lymphatic system with this engraved roller. So you do this about 2 to 3 minutes on the abdomen. Next, we're going to take the cubed massage roller. This is your #1 tool to work on cellulite. So when we get to the buttocks portion, then I'm going to show you what this really can do on the buttocks. But on the stomach, I still use it because somebody can still have dimpled skin. So if someone has dimpled skin, you're definitely using your cubed massage roller. And same thing, you're starting up and you're going back and forth. You're going back and forth. You want to get those sides really good. You want to contour this person, but you're going back and forth, up and down like that. This is your motion. And how much muscle you put into it is up to you. But as you can see, if I'm able to do this on a blow-up doll that's not puncturing or anything like that, it's still very effective. So next, after you spend a good 5 to 6 minutes with your engraved roller and your cubed roller, next thing you're going to do is you're going to use your vacuum suction cup. So your vacuum suction cup plumps up, and normally you will hear like a popping motion. And you take it from the sides, and you'll hear a little pop. You want to suction, and what you're doing is you're suctioning back into the lymphatic system. You're suctioning fat from different areas and putting it back into the lymphatic system so that it will come out when they go to the bathroom and in their colon. So like I said, you're still accessing and stimulating the lymphatic system. So a little cupping here on the stomach, very good with supple skin, very good with wrinkled skin and plumping up an area. But for the stomach, it's just to get those superficial fat cells and stimulate them, stimulate that lymphatic system. So cupping is your third thing. Next is your RF. This is your skin tightening tool. So of course, with each client, you're using these as needed. Each client may not need each one of these tools. But if they do, then this is the way that you use them. But if somebody has a lot of loose skin, then this, you might want to apply some more oil to the area. And this one, you're going in a circular motion. Little circles all around. This is your skin tightening tool, your RF. So you're going all around, circle, circle, circle. Again, just 2 to 3 minutes on this side. And last but not least, you're going to use your sculptor. This is your sculptor, teeth to the client, and you're draining. So you're pushing the fluid just all the way down now. This is your primary sculpting tool, and you finish each area with this each time. So once you feel like you're done with the front and you've used maybe all 5 of these tools or just the tools that you thought the client needed, then that's when you're rotating the client onto their side. So we're going to rotate our client onto her side. So now we have our doll on our side. We're going to use this arnica oil, and we're going to lubricate the area right in here. So the area we're focusing on is this dip right here, because we're trying to give her that hourglass figure. So we're going to leave the hip alone, leave this tender area alone, and we're trying to get right in this area and really contour that area. So this is already most of the time indented. So that's nice and easy to get in there. And you're just going back and forth like this. You can go up and down a little bit, but really you're just going right in there to contour that hip so that we can get rid of those dog ears, get rid of that muffin top, and we're contouring the waist. 2 to 3 minutes with your indented engraved roller. Again, we're going to go in with our cubed roller. And like I said, this person might feel a tickle. They should not feel pain. If this is painful to your client, then it might be too soon after surgery, or they might just be very sensitive. Maybe you just want to use different tools on them. But this should basically, if anything, it might just feel a tad uncomfortable, like tickle. But you're focusing right on that indentation there. And you can use 2 hands or just one this way, and you're just contouring right while they're on their side. Next, you're going to use that cupping motion from both sides. Stimulate the lymphatic system. Get rid of any wrinkles or cellulite. Of course, their arm probably wouldn't be in the way. And you're going to use that cupping motion. 2 to 3 minutes with each tool. The skin tightening you may need, so I'm still going to show it. You can get to the stomach that way. Little circles with the skin tightening tool. 2 to 3 minutes, and then you're going to drain the waist. You're going to drain that to get everything that you just loosened up. This is your part that you cannot skip, is the draining with your body sculpting tool. Once you're good with that side, they go on their stomach and you do their back. So again, just for emphasis, till you get your routine down, I'm going to do all 4 sides just to show you. You're lubricating the area, starting with your engraved roller, starting from the top down, back and forth down, You don't just want to roll down. You want to get some friction there. That's how it's most effective. You want to hear those clapping together and go downward. And use your muscles. That's how it should sound. Then you're going to go in with the cube roller. Same thing. You should hear those cubes knocking together when you're doing this. And you're going downward. This is how it will be. Just like that. 2 to 3 minutes. And the cupping you're using from the sides, going in and down. You might hear a popping. You should hear a popping when you let go, because you want it to suction. It's not going to suction on this, but when you're using on somebody's skin, the only way that you know it's working properly is if you hear that popping is from the suction. And you're sucking that fat and putting it right back into the lymphatic system so that it can drain out. 2 to 3 minutes with this one. Not a lot of wrinkled skin or loose skin on the back normally, but you may need to use the RF skin tightening. 2 to 3 minutes with the skin tightening tool. And then the most important part is the body sculpting with the drainage. So the whole 360 snatch really is between 30 to 45 minutes, depending on your client and their needs and what kind of service you want to offer and your stamina. Because as you can see, like I'm sitting in between this, but normally with the client I will be standing the whole time. And then one more side. We're going to turn her on this side just for emphasis. Keep her covered up. Him or her, I guess. Alright, last side. So we're going to apply the oil here. Lubricate this area. And that dip right in here is what we were trying to insinuate. So we're going to take our engraved roller. If I was standing, it would sound like this. But just for emphasis and just so you know the routine, you're going to do the engraved roller first, right in there, in between the hip and under that bottom rib. We're trying to bring in that waist. 2 to 3 minutes with the engraved roller. Then you go to your cubed roller. 2 to 3 minutes. And it should sound like that. And you're right in here with 2 hands. 2 to 3 minutes. And then we're going to suction, pull, get that skin nice and supple. Any cellulite or wrinkles in that area, this is the skin treatment vacuum. And you're sucking that superficial fat, putting it back into the lymphatic system with your vacuum cup. Any loose skin here, we're going to RF little circles all around the area as needed. 2 to 3 minutes with this one. And then last but not least, your body sculptor to drain that area. And that's the 360 snatch. So next we're going to put her on her stomach. And we're going to undrape this area. We're going to pretend like she's a real client. So we're going to drape her, keep her modestly draped here. So the 3 tools that you're going to use for the butt lift are the cubed roller, your vacuum suction cup big time, and then your body sculptor for drainage. So we're gonna oil this area. You put the arnica oil all down. You want to go like to the back of their knee because you're working on this whole back of the leg. So first we're rolling. Now this is one time that you're just rolling up because we're trying to make those two cute little cuffs under the buttocks. So you're rolling up. You do this a little longer than on the stomach because you only have 2 cheeks to do. So you're rolling, and even if you roll off to the side there, and this should not be too hard. Like I said, the fact that I'm using it on a blow-up doll should show that it's not very deep. This is just a skin treatment, and you're just activating the superficial fat in this area. So you're gonna roll. And you're gonna do this for actually probably a full 5 minutes. You're gonna roll. Then the most important part is the vacuum suction cup, because you're sucking the fat, the superficial fat, and placing it in the area you want it to be in. So you're encouraging this fat in the lower leg to come here to the buttocks area and to the hip area. So you're taking this, you're starting at the lower leg, and like I said, you might hear a popping sound because of the doll. You don't hear the popping sound, but if this was a person, then when I lift it, then you would hear a popping sound. And that's a good thing, because that means that you activated that suction. So again, you would do this for the longest time, I would say 7 to 8 minutes on each side. And you're suctioning, plumping up that butt. If someone has back fat that they're not crazy about, you can also do it to the back. I don't do that too often on someone who's had liposuction because they don't have much fat there. Usually it's most effective coming from this chunky part of the leg here, of the thighs. You're taking that superficial fat from the thighs and pushing it to the buttocks area. And then last but not least, your body sculptor, your sculpting tool, you're going to fluff up. So notice that when I did this butt lift, everything was moving towards the buttocks, because you want to fluff up that buttocks. So this goes right along the side of the thigh here and smooths right over. And you want to do this like the last 2 to 3 minutes of the session, and just smooth this out. And honestly, the butt lift should just feel like a massage. And of course, you want to wait 8 to 9 weeks if they've had a BBL. You want to wait 8 to 9 weeks after their surgery to get this service done, because that way you know that the buttocks is fully healed. If they're at the point where they're not sitting on their buttocks, you don't want to do this yet. You want to do this once you're 8 to 9 weeks out and their butt is fully healed. That concludes our wood therapy practical, showing how to contour the waist and how to plump up the butt area of non-invasive BBL. If you're doing any other body part, like say you're doing the leg or the arm, you want to remember your lymphatic drainage techniques, because that's the direction that you're going to drain, and you just use the tools as needed. Like I said, the cubed roller for cellulite, the vacuum to move fat to different areas, cellulite treatment, skin tightening. It depends on what area you're working on the body and you want to drain with the sculptor in the area, push everything that you loosened up back into the lymphatic system, because it works the same way. Also, when cleaning your tools, I use this alcohol spray, and I just spray the tools down. Not much left in here. I got to get another bottle. But you spray the tools down. I just use pure alcohol and spray them down, and just either wipe with a paper towel or with a towel. Some people have used other different soaps. For people who do hot stones, anything you're cleaning your stones with would work too, because each of these tools is going right on the body with oil, and even though you hope your clients are clean, you want to use very effective cleaning tools when cleaning these after in between each client. So like I said, you might want to get this one is a 90% alcohol spray, and I just spray each tool down and let them dry in between clients. And that concludes our practical portion of our wood therapy class.